Part of the reason of high vaccination numbers in the 12 local government areas is because people are unable to work without this causing more anger and frustration in these communities. They're feeling discriminated against because they're feeling that they're being forced to get vaccinated, whilst other areas of Sydney have a choice. What is being done to work with these communities so they don't feel this way?
Look, I think there's a lot of work going on with our various communities, and has been for a long time, even before this most recent outbreak. Clearly, I think there's always opportunities to do more, and I know that our team in Multicultural New South Wales and the Multicultural Health Communication Service and many other agencies have been engaging widely with different parts of the community to talk about these issues. I think it's important to note that COVID as a virus doesn't discriminate. It doesn't look in terms of geographical boundaries or cultural boundaries. It takes any opportunity to spread between people. And the situation that we're in at the moment is that, as it happens at the current time, the volume of case numbers that we're seeing happen to be concentrated in southwestern Sydney and Western Sydney, where we do see a larger proportion of people who are born overseas or who speak a language other than English. And we recognise that the tight restrictions are extremely tough on families and communities. We recognise that for people who normally would love to visit families and have close social bonds across community and across households, that this is a very difficult time when you're not able to connect with families and communities in that way. But the policies that are in place and the health advice around the stay-at-home orders and around vaccination are there to reduce the risk of transmission, which in turn will reduce the risk of people ending up in hospital and of people dying. And we recognise it's very tough, but from a public health perspective, this is necessary. And we know that even though we have high case numbers, what we know from the Delta variant is that if we didn't have these measures in place and we didn't continue to increase our vaccination coverage, what we would have is a lot more cases. And that's what's played out overseas, and what we know would happen with Delta if we didn't have these tight measures in place, if we didn't have people coming forward for testing as they do, if we didn't have the high rates of vaccination that we have. So appreciate that it's very tough, but unfortunately this is what the Delta variant requires of us if we're to keep control of this pandemic.